we have interrupted this program to bring you an important news update from the Paradigm Challenge. As you well know, there are several environmental health factors impacting the world around us today. Together, we can work to find a solution. For our part, we have taken action by developing an educational short film and webpage with the sole objective of teaching others the importance of manipulating variables in our environment that can be hazardous to the health of our loved ones. A health hazard that creates opportunities for children and adults to potentially choke. On in. Grab a snack, grab a drink.
Don't mind if I do.
Now let's enjoy the show.
I can't wait. Hi, my name is Karis.
Hi, my name is Faith, and we are
The Choking Preventer. I am a choke preventer, looking to remove objects from the environment to make a choke hazard safe. This is important to me because my 2-year-old nephew experienced this.
I am a choking preventer. This is important to me because of my dog Rowdy. He loves to chew on things like this head rubber band, which can be very dangerous. Also because of my dad, who responds to choking emergencies all the time. There are 3 primary environmental factors that can cause potential hazards. 1. Clutter. Excessive clutter can attract rodents, block exits, cause fire hazards, and contain hidden objects that, if inhaled, swallowed, or chewed on, leads to choking. 2. Beautifully colorful and scented liquids may appear as a liquid candy to digest, also leading to a potential choke hazard. 3. Thin and small objects or debris in and outdoors can also lead to choking hazards. Today we are here at our local fire station talking to firefighters. They will give us some tips on choking and how they experience choking hazards in their everyday lives.
I just want to say thank you for coming and answering our questions.
Have you ever had a choking situation that could have been avoided simply by manipulating the variables in the environment?
All the time, especially with the kids, because parents will leave certain items out that are a choking hazard, and if you remove those from a situation, the kid can't choke on them. Or something, and adults, most of the choking situation we've been in with adults has been because they didn't know how to chew their food properly.
We will be talking to a registered nurse.
Have you ever been in a situation where someone has been choking?
Yes, as a matter of fact, I have.
Okay, so how did you handle the situation?
Well, first, I look at the patient, determine if they are in immediate distress, which usually if they're choking, they are. So if it's something blocking their airway, we would cover the airway first. If it's an object that can be removed from the mouth visibly, we will remove that object in order for them to breathe. If you cannot see the object that is causing the choking, you do not want to attempt to do a finger swipe and try to remove the object because it could further dislodge the object in the patient's throat, causing them to severely choke.
Were there environmental preventatives that the individual could use to reduce the chance of choke hazards?
Well, there certainly are, depending on what type of patient it is. If it's a patient that cannot speak for him or herself, on a normal day-to-day basis, say it's a patient that's bedbound, that's unable to ambulate, then you want to make sure that that patient's head of their bed is always in a high Fowler's position, which they're sitting straight up, as you and I all are, and that they're in that position when they're eating. So, because if you're laying back like this, and you're back a little bit further, and you try to eat something, take a swallow right now. When you're sitting back like that, see how you kind of gag a little bit? It's more difficult that way. So me being a registered nurse, if I know I'm feeding someone that can't speak for themselves, I know I'm going to place them in more of a high Fowler's position so that they're sitting up while they're eating and swallowing it.
Okay, before we get started, let's do a pop quiz to see what you already know about choking prevention. Question number 1. Did you know that this is the universal sign for choking? Yay! Everybody answered yes. Question number 2. Did you know that firefighters can also be medical responders? High five! Everybody answered yes. For our last question, did you know that the Heimlich maneuver can also be used to remove items from the throat? Yay! Everybody answered yes. Now you may ask, what can I teach you? Well, I can teach you that to prevent choking in your environment, all you have to do is manipulate the items. Today we are back with another episode of the Choking Preventers. I'd like to give a special thank you to Miss Laura Stevens for joining us here today.
Hi, and welcome viewers for joining us today. Miss Laura, can you please tell our viewers what is your career?
I'm a child psychologist and a board-certified behavior analyst.
Okay.
Would you agree the environment has a major role in health and safety?
Absolutely, and it's something that we as adults and parents can take responsibility of, and really making sure that we keep the area safe for our children and our pets and even the elderly. We have to be careful about them as well. So something you might not even think about, let's say it's a cap on a small bottle, right? Something like this, you might not choke on that, but an animal or a child could, or someone who's getting up there in age, like grandparent possibly, might think that this is something to drink. And that could be potentially very hazardous for them. So we have to be very careful about that. Same thing about like little toys and things. If you've got a little friend around the house, like my little friend here, one of these little toys, a little Lego or something, could be potentially a choking hazard. Not for you, a choking hazard for her, right? So we have to be very careful that we keep these things up and out of their way. A good way to kind of remember it is to think about like an empty toilet paper tube. So anything that's small enough to fit inside of this tube can be a potential choking hazard. So this car, even though it's pretty large, can fit through that tube, so we want to be very careful about that.
That's a good idea.
I thought so.
How would you adjust the environment to stop possible choking hazards?
Well, people do a great job of looking at those choking hazards when their kids are very tiny. But as they grow, we have to get on their level and we have to see the environment from their size. You know, a 3-year-old sees things very differently than a crawling toddler would. So you want to get down on their level and look around and see what they see, what could be potentially interesting to them, and what could they get themselves into trouble with.
Wow, Vera, so you hear that? Even a 3-year-old can choke on something. You have to get onto their level to understand.
So, environmental safety goes beyond manipulation of variables. Could you please tell us how you work with individuals and families to train them on environmental safety?
Absolutely. Parent training is a big part of my job. Not only do I get to work with the children themselves, but working with their families and the other caregivers, you know, babysitters, grandparents, older brothers and sisters. They like toys and things that older kids like, but that's not always a great idea for the little ones. So, you know, little toys like this or a pair of earrings even could potentially be very dangerous. Could you imagine stepping on the back of that? Ouch, it would really hurt, right? So we want to keep things like this up and out of the way. small children and animals. One of the things that we end up doing pretty frequently is what we call redirection. So let's say my little friend here was going for this Lego. I would say, oh, no, not for you, but you can have this, right? And so that simple, oh, I'm gonna take that, but you can have this, that shows them what it is okay to eat. So you could give them a bone or something along those lines if it's an animal, or if it's a toddler, switch that toy out that could cause them harm with something that'll be okay with them, right?
Yeah.
Thank you, viewers, for listening to us today, and thank you, Ms. Laura, for answering our questions.
Absolutely. Thank you, ladies.
Thank you for watching our video.
We hope you use our suggestions to make your environment a safer place by reducing potential choking hazards.